Okay, so I'm going to be going over oral care for mechanically ventilated patients today. So we are going to be doing this about every 2 hours, making sure that we're keeping our patient's mouth clean so that they don't get VAP or ventilator-associated pneumonia. So the first thing that you do, obviously entering the patient's room, washing your hands, putting on gloves. And then you're going to open up your first kit, and it has all your pieces for just your suction. So it has a lower piece. You can have two sets of suction tubing going at the same time. It has this nice little kind of on and off, and then it has this suction tubing with the bag over it to keep it clean, so we're not getting, it's not just laying on the bed and getting dirty and then we're sticking it back in the patient's mouth. So go in, set this up, suction out my patient's mouth, get everything out of there, and then I will grab my first kit, and it has the toothbrush in it and some toothpaste. So I'll get some toothpaste on my toothbrush, and I will gently brush my patient's teeth, making sure I'm getting their molars, top, bottom, left, right, going in small little circles. And I'm doing this with my suction off and then kind of suctioning as needed, so I'm not just suctioning up all the toothpaste that I'm putting on the toothbrush. And then after I do that, then I will get my little green sponge here and my mouth moisturizer, and I will put this all over my sponge and then go through my patient's mouth, making sure to get the inside of their cheeks and all of their gums and all of that, making sure that we're keeping their mouth nice and moisturized. And then leave and come back 2 hours later, and I will grab my next one, and it looks like it's my suction catheter, so I'll hook this up to here, and then with this I can kind of go farther down into the patient's throat and suction beside the ET tube, get everything around there and everything in the back of their mouth that I probably wouldn't be able to reach with just this. So again, just making sure that we're keeping all that clean. We're not letting secretions kind of build up back there since the patient is on a ventilator and they can't cough those up. Then leave, come back in 2 hours, and then I pull out my next one, and I have this suction on this sponge and some more toothpaste type stuff. So I'm going to dip it in here and then go through the patient's mouth. Same as before, you know, inside and outside of their teeth, their tongue, their cheeks, their gums, all of that. And then when I'm done, again, making sure to get the mouth moisturizer on this and go through their mouth again. And then just keep repeating every couple of hours.